We're all witness to the horrors of the second wave. It's still there in our minds, those images that filled television screens and social media from all across the country. The lines, the suffering, the suspense, the absolute horror for lakhs and lakhs of our fellow citizens. And that horror still isn't over just yet, but the second wave is receding. But make no mistake, ladies and gentlemen, there will be a third wave. That's what we need to tell ourselves in our minds. That's the only way, perhaps, to lessen it and make it more mild. Here are the questions that you and I are definitely agreeing to ask at this time. Number one, will it be more or less lethal than the second wave? Will the third wave be more or less lethal than the second wave? Question number two, will it impact our children more, since they won't be vaccinated when the third wave arrives? Question number three, will India see similar suffering, suspense, crowds and horror, the oxygen shortages, etc. that we saw in the second wave? Will all of that be repeated in the third wave, or have we made amends for those shortages? Number four, will the current mutations and future mutations mean the third wave presents even newer complications that we haven't even accounted for yet? And finally, will India be better prepared for the third wave? We saw how the country needed to mobilize because it wasn't prepared for the second wave. Have all those lessons been learned in the third wave? Well, the third wave is definitely coming. In what form is still to be seen. How much of this can be cushioned depends on us completely, say experts everywhere around the world. Sneha Mordani spoke to public health experts about what needs to be done next as we recover from the second wave and brace for the third.
As we see a decline in the second wave of cases, a third wave, according to a mathematical projection by the National Supermodel Committee, looks possible. Scientists have warned against it.
We can expect, let's say, till September, October, people to retain their immunity. So first observation we can make is that the third wave is not going to come before that. If our vaccination pace covers up for that, and so that the percentage of immune population remains reasonably high, then the third wave's impact will be very localized.
The government too has said it will happen.
The phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves.
But medical experts and epidemiologists say the government can avert future disasters only by investing in healthcare workers and public health. India's response to COVID has been tripled by an acute shortage of medical staff, doctors, nurses, paramedics and technicians. The country has 37.6 healthcare workers for every 10,000 people. The World Health Organization's benchmark is a minimum of 44.5. At 562, India has the highest number of medical colleges in the world. But given our 1.3 billion population, the doctor-patient ratio is abysmal. 9 doctors per 10,000 people, as against 42 in Germany, 28 in the UK and 26 in the US. There are only 15 nurses for every 10,000 individuals. The UK has 150, Germany 132, the US has 85, China has 23. China, which is more populated than us, has 3.61 million doctors, nearly thrice that of India.
All the vacancies of frontline workers who are instrumental in doing the earlier actions in terms of testing, contact tracing, and also for actions including clinical care. This time we should not have any excuse for not preparing for multiple waves.
Experts say surveillance is also the key.
In order to prepare for aggressive containment, we need to have a really strong and proactive surveillance system. This can be done only by expanding the surveillance system's reach and also capacity in terms of identifying cases as early as possible. The moment we identify such clusters, we should be investigating it and preventing it from further spread.
Vaccination is our weapon to minimize the adversities of a third wave. The speed of vaccination should increase many folds to reach at least 10 million doses per day over the next few months.
We need to vaccinate as many people as we can before any sort of third wave hits us. The more we vaccinate, the better prepared we are.
Also, involvement of the private sector to handle the crisis, increased bed capacity and better resources, the paucity of which saw India collapse during the peak of the wave. The government says a lot depends on the people and we can have the situation under control even if the mutating virus keeps us on the edge.
Given the variant, given the reduced protection from vaccination, good protection against severe disease, but not full protection against infection, and enough number of unvaccinated people in every country, I believe outbreaks is a reality that everybody has to be on guard against.
This is an opportunity for governments to build strong and resilient healthcare systems. This pandemic, especially the second wave, has exposed India's dismal healthcare system completely. The need of the hour is to invest in India's healthcare structure, the system, increase spending on healthcare. Clearly, radical solutions are required. In New Delhi, Sneha Mordani for India Today.
Now, how lethal is this third COVID wave going to be? There is much that we don't know, but the experts have weighed in. And this is going to be very useful for all of us because India Today has spoken to India's top doctors and got them to very briefly list their warnings, their advice, their prescriptions for all of us as citizens ahead of the third wave. Take a look at this.
It is very difficult to predict what will happen in the third wave. Now, what we are seeing with this virus is that the biggest risk could be that if it does mutate again, can the symptoms be different? Can the presentation be different? Can it affect a different age group? There's no way to predict when it can happen and how it will happen. So the best thing at this point is to prevent the third wave is to follow all the preventive measures like wearing double masks, washing your hands, practicing social distancing, and above all, vaccination. I think these are the only ways that we can actually hopefully control the third wave if and when it happens.
Concerns of a third wave are already being discussed. Researchers are doing studies to estimate how many people remain susceptible to the coronavirus and where those populations reside. Despite the need for more data, based on what we already know and out of an abundance of caution, we should anticipate that there very well could be a potential third wave. So the natural questions are, when and how big? These points depend on several factors and of course are very difficult to predict. After all, models cannot predict adoption or adherence to new policies. Despite this, there are several things that we can do now. First, we can continue to minimize social interactions, even after lockdown measures are lifted. Mass gathering should also be avoided. When social interactions are unavoidable, it is important to continue wearing face masks. And last, we need to increase vaccination, especially in populations that are at highest risk. Older individuals and those with comorbidities. These are the best tools that we have to fight this pandemic.
The second wave of the coronavirus has ravaged the national capital. You saw those images from Delhi right through the second wave. People running from pillar to post looking for beds, for oxygen, for ICU, for ventilator, concentrators, essential medicines, and even space in crematoriums. But now the Delhi government appears to be taking the first steps in at least acknowledging that it has learned a lesson. The national capital is prepping itself for a possible third wave, officially so. The main focus remains on ramping up ICU and oxygen beds. A special task force has been set up by the Kejriwal government in Delhi to protect measures, especially children.
The deadly second COVID wave is ebbing in Delhi. Overwhelmed hospitals now have vacant beds. Frequency of the frantic SOS oxygen calls have reduced, and the overburdened capital healthcare system is finally breathing a little easy. But the Kejriwal government is not letting its guard down. Learning its lessons from the second wave, the capital is ramping up its infrastructure to prepare for a possible third wave. The Delhi government has set up a 13-member committee to prepare an action plan after assessing the current status and projected requirement of health infrastructure such as hospitals, oxygen plants and drug supplies in the city. Another 8-member panel has been tasked with devising a plan for reducing the impact of the third wave. This panel will also look into the specialized needs of children in the city, as several reports suggest that the third wave will impact kids the most. A medical panel has also been formed solely to focus on oxygen requirement.
4 सदस्य कमेटी बना के इसकी पूरी जांच की जाएगी कि अगर कहीं से इस तरह का कोई सूचना, इस तरह का कोई क्लेम, इस तरह का कोई दावा आता है कि यहाँ पर ऑक्सीजन की कमी की वजह से किसी मरीज की डेथ हुई, तो उसकी पूरी जांच की जाए.
The daily COVID cases in the capital have been below the 1,000 mark for almost a week now, and the positivity rate is also below 1%. But the Delhi government is leaving no stone unturned to prevent a rerun of the COVID second wave.
Out of the 58 PSA plants, only 9 are operational right now, but the Delhi government is currently ensuring that about 44 such PSA plants are made operational latest by July end of this year to help fight the impending third wave of COVID-19. With Ajay Thakur, Milan Sharma for India Today.
Delhi could see well over 45,000 cases of COVID in the third wave. 9,000 hospitalizations will be needed, says a report prepared by IIT Delhi. That's the projection. And that's one of the 3 scenarios according to the institution. The report also says that the medical sector needs to be ready. The medical industry says it needs the government to step in. Anisha Mathur and Sneha Mordani get you the latest on the national capital.
Delhi will see a surge and it could challenge the national capital once again. That is what a report submitted to the Delhi High Court by IIT Delhi says. Surge in cases up to 45,000 a day, with 9,000 hospitalizations every single day can be expected. Prepare for the third wave is what the report is suggesting. The suggestions include building oxygen storage capacity, looking at supply of oxygen from outside Delhi, preparing a portal for the same, ensuring compatibility of nozzles, refillers, capacity evaluation, planning manufacturing units for oxygen production, and addressing shortage of cryogenic oxygen tankers. Overall, scenario building plan the infrastructure requirements for COVID third wave.
The IIT Delhi Department of Management, in its detailed status report before the Delhi High Court, has flagged 9 specific areas of concern, which includes not only oxygen transport, distribution and storage, but also the online databases and apps created by the Delhi government to keep track of the hospital beds, oxygen, medicine, etc. availability. In addition, the IIT report also says that the third wave of the pandemic could be even more infectious and could require even more hospitalization, beds and oxygen for the city. The Delhi government has assured court that their plan for COVID management going forward will take into account all of these areas of concern.
The report says there could be 3 scenarios. Third wave scenarios. Number 1, same as peak patient load of COVID-19, second wave. Scenario number 2 is 30% increase in patient load over scenario 1. Scenario 3, 60% increase in patient load over scenario 1. The medical industry has approached the government saying the need is to stockpile COVID essential medical items to face the third wave, same as at least 47 of them. Experts are saying there is an urgent need to create a stockpile of 25 to 30% of the annual national demand and warehouse it in the 4 geographical zones.
We've been recommending to the government to create a stockpile which should be 25 to 30% of the annual procurement by the central and state governments as a national stockpile at 4 different geographical zones, and to create a production-linked incentive scheme, which is more important for the MSME sector to ramp up the production of these critically needed 41 COVID medical device items, and to reduce GST on the 18% COVID medical device items to 12%.
The 47 essential COVID items that the industry wants stockpiling of range from air mattresses to swabs to digital thermometers, masks, PPE kits, glucometers, among others. The industry has also said there should be a reduction in GST from 18 to 12% for 40 medical devices.
As we saw with the PPE and the COVID test kits, India has to depend on itself. We look forward to the Government of India announcing some encouraging schemes for the local manufacturers to boost sales and stockpile of the essential items.
These projections made by scientists for Delhi and for different parts of the country help in assessing the situation. It puts the focus back on where we need to prepare. It looks like that the third wave is inevitable. The idea is to ensure that no reaction is knee-jerk and that this time around the virus doesn't get the better of us. With Anisha Mathur in Delhi, Sneha Mordani for India Today.
What about the other big cities of the country? How is India preparing for this possible third wave? India Today's team of reporters went out into our 6 big metros to bring you this point-by-point report on how their cities are preparing for the next wave. Take a look.
There is a report that has been submitted to the Delhi government by IIT Delhi which shows 4 possible scenarios that could occur in the third wave. The first scenario says that the cases could reach up to 28,000, which is similar to the second wave. There's another scenario that says the cases could come up to 36,000 or more per day. But the scariest one is if Delhi ends up facing 45,000 cases of coronavirus per day. The government says that the bed capacity and ICU bed capacity has to be augmented, and that's why the Delhi government is preparing about 40,000 COVID special beds in the state.
Mumbai is getting itself well prepared for the third wave. First of all, after the second wave, Mumbai is very much cautious. Secondly, a special pediatric task force has been already formed, and they will also be the mentors of the treating doctors. A special COVID care centers for children have already been made. They will have special playful activities, also special children ventilators and the medicines as well. The COVID care centers will also be looking to have so that the parents can be with their children and monitor them and be with them. Special focus will also be given to the slum areas. Chief Minister Uddhav Thackeray is himself monitoring the whole situation.
While the West Bengal government deals with the second wave of the pandemic right after a marathon election, preparations are also underway to tackle a possible third wave. The state government has taken a 3-pronged strategy to ramp up the number of COVID beds in hospitals, to also see that there is a smooth supply of vaccines, and to address if there is any scarcity of medical oxygen.
Though there was a delayed onset of the second wave in the state of Tamil Nadu, the state fared much better than many other states in the way it had prepared itself. What did Tamil Nadu do right? Well, one, they'd increased the bed in the state, they'd increased the oxygen availability and oxygen beds in the state, and also they ensured that there was continuous triaging and contact tracing that was done, and also a unified command center was ensuring that help was reaching people who were in dire situation. Apart from that, the state has also been focusing on getting people vaccinated, as many as possible.
Karnataka government has roped in well-known Dr. Devi Shetty to chair the panel to tackle the third wave, which is upcoming in post-September time. And also on ground, the government has trying to prepare 70 to 80 bed COVID care centers at district and taluk levels for only kids at pediatric zones. And also a special drive to be carried out to train the health staff to teach them how to treat the kid with better facilities.
Despite the vaccination crunch, the whole strategy of government of Telangana is to vaccinate as many people as early as possible, and that's why these kind of mega vaccination centers, particularly focusing on the super spreader group like RTC drivers, bus and taxi drivers, auto drivers, journalists, it has been created across the state. Chief Minister K. Chandrasekhar has also instructed the health department to increase oxygen beds across the state, also procure at least 600 tons of oxygen before the onset of third wave of COVID-19.
Meanwhile, speaking of the third wave, in Maharashtra's Ahmednagar district, nearly 9,000 children have turned COVID positive in just the month of May, and it has caused a lot of concern. India Today did a ground report about the reason for these 9,000 children getting infected with COVID in a single month and what pointers it could have about what we face in the third wave.
(16,541) children infected with COVID in the 2 months of April and May. The second wave has hit all age groups in Ahmednagar district. At this COVID center, 20 kilometers from the city, the doctor in charge tells India Today there are 52 COVID positive kids undergoing treatment. All the kids have mild symptoms and there are no complications.
5 to 15 years, many pediatric patients admitted in center, but now 12 to 10 patients are below 5 years, pediatric patients. With mother, when mother come positive, then pediatric patient also, baby come positive.
आज ही पॉजिटिव आई है सुबह।
टेस्ट किया क्या आपने?
हाँ टेस्ट किया।
तो उसको सिम्टम्स क्या है?
उसको बुखार है और सिर में दर्द है।
The Ahmednagar administration confirms nearly 9,000 kids have tested positive in May. Of the 77,500 infections in the month, 8,881 or 11% are kids. Keeping this in mind, the administration is gearing up with new COVID centers for kids equipped with ventilators.
चिल्ड्रन का जो है कि हम एनालिसिस कर रहे हैं, उसके लिए जो है कि बाल रोग तज्ञ का टास्क फोर्स भी हमने कॉन्स्टिट्यूट किया है और टोटल हमारी कार्रवाई चालू है.
Experts, however, say the new trend should not cause any alarm.
In last 6 months in Maharashtra, at least I can tell you, the percentage of 0 to 5 kids among the total positive cases is near about 1% to 1.5%. It has not changed at all.
India Today visited a home in Pune where 3 out of 4 kids have tested positive. The family says 2 of them were asymptomatic while 1 faced dehydration.
So I would like to give a message. Please keep children hydrated because it is dehydration which causes more discomfort.
We got immediately admitted and they started our treatment. My health, it was till 4 days I wasn't feeling well. I had fever, cough, but that's it.
Although 8,000 to 9,000 kids have tested positive within a month's time in Ahmednagar district, the state surveillance officer says nothing to worry. He claims that same are the figures of kids testing positive.
COVID is killing many young children, especially in Brazil. There's also news of a COVID variant in Singapore infecting children. And hence, there's an alarm in India about protecting children from the third wave to come. Will the third wave impact our children more has become an overarching concern as we prepare.
COVID kills over 2,000 children in Brazil. Mothers give birth to stillborns. And hence today, the worry increases on whether India can run into the same fate given the cavalier response of the government. The focus now is to protect Indian kids.
The lack of health infrastructure will actually sicken more people. And that's inherently the greatest, saddest thing, because those things are preventable with public health measures. And so I really pray that India gets its healthcare infrastructure improved.
An abundance of population is a matter of concern for India that could see a third wave. But would it be worse and impact kids more? Experts say there is no evidence as yet.
I think out of an abundance of caution, we should potentially plan for a third wave. And in terms of whether it would be even worse among children, I've seen no evidence to suggest that the current wave is any more severe in children. When we have so many cases of confirmed COVID disease in the population overall, naturally, we're going to see a tremendous number in children as well.
A concerned mother and also a doctor who wants to vaccinate her child has questions on vaccination repercussions on kids.
You know, what I worry about is, okay, what would the next wave be? What's the next variant? But then I also worry about what are the risks of the vaccine. So if right now the kids, the mortality rate is extremely low, then if I'm giving my child a vaccine and the vaccine has a higher mortality rate than COVID itself, then I'd want to understand that. I'd want to know.
We have these trials, and this is why children are getting the vaccines later than adults. And in terms of the actual consequence, there's no proven clotting in children. There's no assumed risk. But we know there's a huge known benefit, right? The huge, large benefit. And there's no apparent risk in children whatsoever.
India has lessons to learn from the deadly kids wave in Brazil and pick cue from the catastrophe and be prepared regardless. In conclusion, epidemiologists are of the strong opinion that a third wave is likely in India, with not much evidence to prove that it's going to be worse in kids, but there would be no excuses for India to not prepare. A proactive, precautionary stance is what India needs to adopt. In New Delhi, Chaiti Narula for India Today.
Breaking news coming in. India's Zydus Cadila will be seeking emergency use approval for its vaccine candidate Zycov-D from the drug controller in the next 2 weeks. Zydus Cadila has assured 5 crore doses of Zycov-D by August-September this year. The Zydus vaccine can also be used to inoculate children, as its trial is already underway on young persons. That's the breaking news that we're getting right now. This will be, in fact, hopefully the 4th made in India vaccine, or the 3rd made in India vaccine. The first is Covaxin, then you have the biological E vaccine that's currently in formulation, and now the Zycov-D made by India, Zydus Cadila, will be seeking emergency use authorization in the next couple of weeks to roll out crores of doses by August-September. Good news on the vaccine front there.